Hello, my name's Kareem.
Hi, my name is Christian.
Hi, my name is Eduardo Verti. I'm a part of the Bcom 1300.008 group with Professor Alberg, and today we're going to be presenting a proper coverage healthcare plan for employers nationwide. So the current issue that our nation faces is that there's no sustainable form of healthcare benefits for our employers. There are currently no laws directly requiring employers to provide healthcare coverage to their employees. Despite this, penalties would be given by the ACA if they do not directly give this form of coverage. The ACA, the Affordable Care Act, requires employers with 50 or more full-time employees to provide insurance to 95% of their employees. The majority of the time, large corporate companies tend to provide only the bare minimum requirement. Aflac's annual employee findings survey in 2016 showed that 60% of employees would take a job with lower pay but better benefits. And with this, almost a quarter, which is 23%, of full-time employees had no access to any form of benefits. Due to extensive costs, small businesses opt out of basic insurance. There are currently small national business efforts which companies have made contracts directly with independent hospitals and clinics. Firms designate some facilities as centers of excellence, and health plans given offers services at retail clinics.
Businesses around the nation have many options in order to reduce costs of healthcare plans for their employees. One option employers have is directly negotiating prices with facilities, although, according to the 2019 Employer Health Benefit Survey, only 8% of employers with more than 200 employees have taken the strategy. Firms can also designate certain facilities as centers of excellence. This means that the facility both offers quality care and an affordable price. This is something that 16% of firms with 50 or more workers are currently doing, according to the 2019 survey. Allowing access to retail clinics is also another option firms have. Retail clinics include pharmacies and stores such as Walmart or CVS. This is an option that currently 82% of firms with more than 10 employees have taken, with 16% of those firms incentivizing their employees financially. Many employees have not received the proper healthcare plans due to mistakes by their employers. Many employers do not try to negotiate prices with their providers, although they may be able to due to their company's high volume. Many firms aren't informed about the options they have in order to reduce prices for their employees. Many employers also don't have available the information they need in order to properly assess the providers they offer their employees, according to the Health Benefit Survey. Another mistake by employers is that they don't eliminate providers that have high rates or poor practices from their network. Providers that offer high rates and poor practices should be removed from firms' networks as they provide no use to their employees.
We believe as a group that the most effective solution on the issues of current healthcare benefits are that there should be a designation of certain facilities as centers of excellence. These centers of excellence should provide people with the best healthcare options. We also think that these centers of excellence should have a certain criteria. These firms or centers should dedicate their time into researching into their network in order to find out what are the best healthcare options. We also believe that any facility that has poor practices and high costs should not be designated as a center of excellence. We incorporated two businesses that are here in Dallas that are showing an effort in order to tackle the issues on current healthcare benefits. We included these businesses because we believe that they are real life examples of how some businesses are actually trying to put in solutions that have been currently working effectively. These two businesses are Lowe's and New Star Energy. Lowe's has been displaying itself as a center of excellence by providing its people with the best healthcare options and putting in research in order to filter out their poor practices and how they can lower costs. We also believe that Lowe's has been negotiating bundled payments with their employees. New Star Energy, on the other hand, has been providing 100% healthcare coverage and has on-site medical facilities for staff. This makes it a lot easier for staff to be able to get the health care that they need. In conclusion, many firms do not put in any effort to try and get the best coverage that they can for their employees. Most large companies can tend to be a little bit selfish and provide only the bare minimum requirement of healthcare benefits. Almost a quarter of employees that work full-time have no access to any benefits due to this selfish act through the employers and some firms. Hence, a good solution should be designating certain facilities as centers of excellence and providing this information to employees so they will know exactly who to get excellent coverage from. Thank you, and I hope you enjoyed the presentation.